Now to growing concerns about the deadly coronavirus officially hitting the U.S. Here's what we know. A Washington state resident fell ill after returning from Wuhan, China, where the outbreak began. Officials now say more than 400 people have been sickened and 9 people have died. The World Health Organization is holding an emergency meeting right now. Kana Whitworth is in Seattle, has the latest for us. Good morning, Kana.
Hey, Robin, good morning. So that patient is a man in his 30s. He is in the hospital here behind me. Now, officials are describing his condition as satisfactory, but he will remain in isolation for at least the next couple of days. They will continue to monitor him as well as the healthcare providers and patients he came into contact with after testing positive for the coronavirus.
The first case of the deadly Chinese coronavirus making its way to the U.S., a Washington state man testing positive for the deadly virus. According to the CDC, the man in his 30s flew home to Seattle last Wednesday, infected but not yet symptomatic. According to officials, shortly after arriving in Seattle, he began feeling ill and reached out to his healthcare provider on Sunday. 24 hours later, his diagnosis was confirmed by the CDC. The man entering the country before federal health officials began screening travelers from the city of Wuhan, one of the busiest transportation hubs in central China, and where the outbreak began.
This is certainly not a moment for panic or high anxiety. It is a moment for vigilance.
This as some 3 billion trips are expected to be made by Chinese citizens heading home to celebrate the Lunar New Year Spring Festival. A reported 7 million Chinese tourists expected to travel abroad. Chinese officials taking every precaution to contain the virus. Workers outside of the local hospital in biosuits. Officials screening travelers as they enter and leave the airport. Our Bob Woodruff is here, walking through Wuhan Airport, wearing a 3-ply surgical mask to limit his exposure to the virus.
The city is now controlling people going in and out of the city. Then also local tourist groups are being banned from leaving. The government does not want this infection to leave.
Screenings now expanding to 5 U.S. airports, including Chicago and Atlanta. And anyone hoping to enter the U.S. from Wuhan must do so through one of those locations.
So right now the CDC is retracing this Washington man's steps. They say he actually did not visit that fish and meat market in Wuhan where they believe this virus originated. And also, Michael, they're really crediting this man for quickly alerting doctors once he became symptomatic.
All right, thank you so much, Kana. And now we're going to bring in Dr. Jennifer Ashton to answer a few questions that we may have. And Doc, there's so many questions about transmission of the virus. Right. We did human to human. Yesterday we talked about that. What more do we know at this point?
Well, again, what we know is that it's spreading. That's not really a surprise. What we don't know is a lot about this virus. We don't know its incubation period. We don't really know the route of transmission. It is a coronavirus, which normally spreads via respiratory droplets, but we don't know the specifics on this new one. We don't know how contagious it is, which means what percentage of people exposed will actually get sick, and we don't know the severity of the illness. How many will go on to develop mild symptoms, things like pneumonia requiring hospitalizations, and we certainly don't know the fatality rate yet.
And at this time, what has been done to protect the public here in the U.S.?
A lot being done, and we have to emphasize, Michael, a lot of this has been prepped and primed by the response of not only the CDC, but the World Health Organization in response to SARS. So we know how to act more quickly, more efficiently. Here in this country, as we heard, flights coming from Wuhan will only be allowed to land at certain airports where this screening can take place. Passengers will then be screened, and if sick, they will be isolated. If asymptomatic, they'll be given very important educational materials, as Kana said. Healthcare providers urged to screen, and new testing methods being gotten out there by the CDC so we can identify these cases more quickly.
All right, Doc. Thank you.
You bet.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.